Hey everyone, I wanted to give a quick summary on what is known about what appears to be very rare reports of blood clotting associated with the AstraZeneca and Johnson & Johnson vaccines. While all medications and vaccines have side effects, it's important to remember that to date, the vast majority of vaccine side effects have been mild, resolve on their own, and are not serious or life-threatening. There are several factors to evaluate, and while health experts consider the vaccines to be safe, these events could reinforce vaccine hesitancy, so it's important to talk about. Let's explore what we know about blood clotting in each of the vaccines, recognizing that much of this is changing in real time. As of early April, there are now around 200 cases of rare blood clotting issues observed in people who received the AstraZeneca vaccine in the UK and several European Union countries where it was first authorized. The incidence of clotting, based on the current number of vaccinations given, is thought to be around 10 per 1 million people. Early reports seem to indicate that affected people are under the age of 50 and more likely to be women. As a result, several countries have taken cautionary steps to restrict or pause vaccinations. Germany and Spain recommended the AstraZeneca vaccine be given only to older individuals, and Britain stated they would not use it in people under the age of 30. Some EU countries have stopped using it altogether. Remember, the AstraZeneca vaccine has not been authorized for use in the US, and there is much being discussed as we wait further studies to learn more. What about the Johnson & Johnson vaccine, which was just started to be used in the US? As of mid-April, around 8 to 9 million vaccinations have been given, and there have been 9 reported cases of clotting, or approximately 1 event per 1 million vaccinations. As a result, the FDA and CDC, very similar to the European counterparts, paused administration of the vaccine to evaluate this further. It's important to put these observations in perspective with both vaccines, but I'm going to focus on the J&J vaccine because that's what's available in the US. So what do we know about the individual cases? First, there appears to be a temporal association or some time relationship to the vaccine, as clotting seemed to occur within a few weeks after vaccination. Secondly, the clots themselves were occurring in unusual locations, in the cerebral vein in the brain, veins in the abdomen, lung, and even arteries, locations that are not very common. All of the patients tended to have low levels of platelets in the blood as well. Finally, the patients tended to be healthy or at least medically stable and reported escalating symptoms of headache, confusion, shortness of breath, abdominal pain, and weakness. But as opposed to typical vaccine side effects, these symptoms worsened in severity over time. Remember, we still aren't certain if there's a link between the J&J vaccine and the clotting syndrome. There could be, but we need to rule out other explanations. For example, clotting may be related to some underlying condition, or it might have occurred even without vaccination. And it raises an important question. How common is it, in general, without vaccinations, for this type of clotting to occur? Studies in the scientific literature state that clotting in the cerebral vein can occur in between 2 to 15 per 1 million people. Reports of clotting elsewhere in the body show even lower incident rates of between 0.2 and 1 per million. So blood clotting in general is extremely rare, and even what we know of the clotting incidence with vaccines would still be considered a very rare event. As we've talked about in prior videos, getting vaccinated is a risk-benefit decision. While even a 1 in a million chance of clotting is a scary thought, consider that there's a 1 in 500,000 chance of being struck by lightning, a 5 in 10,000 chance of having a serious allergic reaction to penicillin, and a 1 in 2,000 chance of developing a blood clot while taking an oral contraceptive. We need to learn more about the clotting risk associated with the vaccines and its true incidence. Researchers are now conducting a large study of the health records of 12 million patients, and we hope to have some further information. Based on the current guidance and data, the benefits of vaccination still far outweigh the risks. Consider that with millions of vaccinations administered in the US and the world, the rate of reported adverse events, including mild or moderate side effects such as arm pain, fatigue, headache, chills, is very low, and the vaccines are almost completely protective against hospitalizations and death. We'll continue to keep you updated and await further guidance from the CDC and the FDA on resuming the use of the Johnson & Johnson vaccine. So thanks for joining today. I'll be back with more Clinically Speaking as we continue to learn more. Be sure to sign up for weekly news, insights, and updates at evernorth.com. Until next time, stay healthy, stay safe, and stay informed.